That burning feeling when you pee, the urge to go every few minutes, a dull ache in your lower belly. If you have ever dealt with those symptoms, your provider may have ordered something called a urine culture and sensitivity test. Most people have never heard of it, and even fewer know why it matters so much. Here's the short version. This test does two things at once. It checks whether bacteria are actually growing in your urine, and it figures out which antibiotics can stop those specific bacteria. Both of those pieces are critical for getting you the right treatment. You may be wondering how this is different from a regular urine test. A standard urinalysis, the quick one done in most clinics, looks at your urine under a microscope. It checks for signs of infection, like white blood cells or nitrites. Results come back in minutes, and it is often the first step when a UTI is suspected. But a urine culture goes deeper. The lab places your sample in a special dish and actually grows any bacteria present. That process takes 24 to 72 hours. Once the bacteria are identified, the sensitivity part of the test checks which antibiotics kill them most effectively. Think of it this way. The urinalysis asks, is something wrong? The culture and sensitivity test asks, what exactly is wrong, and what will actually fix it? That second question matters more than most people realize. Not all antibiotics work against all bacteria. According to the Centers for Disease Control and Prevention, antibiotic resistance is a growing problem worldwide. When a provider prescribes without knowing the exact bacteria involved, there is a real chance the medicine will not work. The infection can linger, get worse, or spread to the kidneys. The sensitivity results take the guesswork out. The lab exposes the bacteria to several different antibiotics and records what happens. Results fall into three categories: susceptible, meaning the antibiotic works well; intermediate, meaning it may work under certain conditions; and resistant, meaning it will not work at all. Your provider uses that information to choose the safest, most effective option for you. Not every UTI requires a culture. For a straightforward first-time infection in a healthy adult, many providers treat based on symptoms and urinalysis alone. But the National Institute of Diabetes and Digestive and Kidney Diseases recommends a culture when symptoms do not improve after a first round of antibiotics, when UTIs keep coming back, during pregnancy, or when there are signs the infection may have reached the kidneys, things like fever, chills, or back pain. Collecting the sample requires a clean catch midstream technique. Your lab or provider will walk you through it. Following those steps carefully matters, because a contaminated sample can show bacteria that were never really there, leading to treatment you do not need. If you are dealing with UTI symptoms, do not wait it out. Connect with a licensed provider, describe what you're experiencing, and let them help you decide whether a culture is the right next step. Getting the right antibiotic the first time means a shorter illness and fewer complications.